Good afternoon, everyone. The topic for today's class is evaluation. The contents are introduction, definition, elements of evaluation, types of evaluation, steps in evaluation, conclusion, and references. Evaluation is defined as the collection and analysis of information to determine the program performance. It is mostly concerned with the final outcome and the factor associated with it. The criteria used in the evaluation of the health services was given by WHO in the year 1972. It includes effectiveness, appropriateness, efficiency, and adequacy. The elements of evaluation. Evaluation is perhaps the most difficult task in the whole area of health services. The components of evaluation process are relevance or requisiteness, which relates to the appropriateness of service, whether it is needed at all. If there is no need, the service can hardly be of any value. Second is adequacy, which is implied that sufficient attention has been made to certain previously determined course of action. Third, accessibility. It is the proportion of given population that can be expected to use specified facility, service, etc. The barriers to accessibility may be physical, economic, social, elevated, or cultural. Fourth is acceptability. The services provided may be accessible but not acceptable to all. And fifth is effectiveness. It is the extent to which the underlying problem is prevented. Thus, it measures the degree of attainment of predetermined objectives. The ultimate measure of effectiveness will be reduction in mortality and morbidity rates. Sixth is efficiency. It is the measure of how well the resources are utilized for the effectiveness. Impact, which is an expression of overall effect of program, services, institution on health services and socioeconomic development. So planning and evaluation must be viewed as a continuous interactive process leading to continual modification of both objective and plan. Successful evaluation may also depend on whether the way of evaluation was built into program design before being implemented. Coming to the types of evaluation. There are different types of evaluation based on the object being evaluated and the purpose of evaluation. The most important basic types of evaluation are formative and summative. So first we'll talk about formative evaluation. It refers to the internal evaluation of the program. It is the examination of the activity of the program as they are taking place. It is usually carried out to aid in the development of the program in the early phases. Second is summative evaluation. It judges the merit or the worth of the program after it has been in operation. It is an attempt to determine whether a fully operational program is meeting the goal for which it was developed. So these are the two main types of the evaluation. Coming to the evaluation of health services have become complex and there have been a growing concern about their functioning both in the developed and the developing countries. Questions are raised about the quality of medical care, utilization and coverage of health services, benefit to community health in terms of morbidity and mortality reduction, improvement in the health status of the recipients under care. So this is the rational planning model in which where it requires the identification of the need in a community, the available options are being chosen, then the decisions of the policy makers is there to utilize the available resources. We implement the program or the planning model and after which the evaluation of the health services is being done. Coming to the steps of evaluation. So there are mainly 7 steps in evaluation. That is, determine what is to be evaluated, establish the standards and criteria, plan a methodology to be applied, gather information, analyze the result, take action, taking action, and re-evaluate. We'll talk about the steps in detail. So coming to the first step, that is to determine what is to be evaluated. There are three types of evaluation: structure, process, and outcome. Structure evaluation helps to evaluate whether the facilities, equipment, manpower, and organization meet a standard accepted by the experts as good. Process evaluation: the process of the medical care includes the problem of recognition, diagnostic procedures, treatment, and clinical management. The way in which the various activities of the program is carried out is evaluated by comparing with the predetermined standard. An objective and systematic way of evaluating the physician's performance is known as medical or nursing audit. Outcome evaluation: it is concerned with the end result, whether the person using the health services experiences measurable benefits such as improved survival or reduced disability. The traditional output components are the 5 Ds of the ill health, that is, disease, discomfort, dissatisfaction, disability, and death. So, this is very important to determine what is to be evaluated. Next step is to establish the standards and criteria. The standards and criteria must be determined how well the desired objective has been attained. Such standards are a prerequisite for evaluation. Standards and criteria should be developed in accordance with the focus of evaluation, structural criteria, process criteria, and outcome criteria, or behavior resulting from the healthcare or the education process. The next step after the establishing the standards and criteria is to plan the methodology, which is a format in keeping with the purpose of evaluation, which must be prepared for gathering the information desired. The standards and criteria should be included at the planning stage. So methodology includes all the methods that will help in gathering the information about the program. If the program has been planned, so we have to evaluate it on the based on the various methods. The next step is to gather the information. So evaluation requires collection of data or information. The information required may be political, cultural, economic, environmental, and administrative, influencing the health situations, as well as mortality and morbidity statistics. It may also concern health and related socio-economic policies, plans, and programs, as well as extent, scope, and use of health system, services, and institutions. The amount of data required will depend on the purpose and use of evaluation. Next is analysis of result. The analysis and interpretation of data and feedback to all individuals concerned should take place within the shortest time feasible once the information has been gathered. In addition, the opportunity should be provided for discussing the evaluation results. So this is very important that we have to analyze the result and the findings of the study, that whether the positive results were there or the negative results were been there. The result depends upon the study population, that how much was the population and to what extent the services have been covered to fulfill the outcomes and the criteria of the study. And if not, then we have to take actions. So for evaluation to be truly productive, emphasis should be placed on actions designed to support, strengthen, or otherwise modify the services involved. This may also call for shifting the priorities, revising objectives, or development of the new programs or services to meet the previously unidentified need. So this is also very important to take actions on the basis of the requirements of the program. And the last step is to re-evaluate. So evaluation is an ongoing process aimed mainly at rendering the health services more relevant, more effective, and making it more efficient. So we have to do the re-evaluation always. Conclusion: evaluation helps to determine the worth of the program, to assess if it has been performed as prescribed, and to discover whether the required performances and objectives have been achieved. It should demonstrate the extent of the combination to the oral health in the target population and whether each part of the program is relevant and appropriate. So these are the references. You can refer these textbooks for further reading. Thank you.